I'm Patti Davis. I started a support group for caregivers of people with dementia years ago. I ran it for 6 years. I structured it with a co-facilitator from the medical field so those questions could be answered. And after 6 years, I tried to broaden it to have hospitals license the group. Hospitals aren't always very amenable to caregivers, in case anybody watching this doesn't know that. So that didn't take off the way I wanted it to. And now what we're trying to do is run a support group online so that people can just go to their computers and get the help that they need, because this can be a very lonely journey. So let me start first. My emotional support dog is here. Let me start first with the diagnosis. Usually it's not a surprise. Usually someone has been showing symptoms, and so you take them to the doctor. I would suggest taking them to a neurologist, not your general practitioner, because you need to know what kind of dementia it is. If in fact it's dementia, some things can mimic dementia and aren't. B12 deficiency, thyroid deficiency can actually have dementia symptoms, and it's not. So you do need a complete workup. But if it is dementia, a neurologist needs to diagnose that. Sometimes it is a surprise. Sometimes if someone has surgery and goes under anesthesia, dementia that's been lurking in the brain and hasn't really manifested yet can suddenly manifest. The same is true with a head injury. The same is true with a stroke. But usually you have some preparation, or you think you do. When the diagnosis is made, generally you feel unprepared because a whole world has just changed. One of the things that's going to come up is the question about new medications that are designed to slow down the progression of dementia, particularly Alzheimer's. It is not my place to tell anybody what to do or what decision to make in terms of those medications, but I do want to point out that I think there's a really important question to ask in this, which is that the earlier stages of dementia are the hardest ones. The person is cognizant of the fact that they are losing cognition. So I think you want to ask yourself if you want to slow things down so that they linger in that stage. And it's an individual choice, but I think that's an important question to ask. The other thing that you need to know is after a diagnosis is made, the doctor is legally required to notify the DMV that this particular patient now has dementia. I'm going to talk more later about driving. That's a whole other topic, but you do need to know that they are required to do that. Also, sometimes doctors don't tell the patient. They leave that to the family members. I think it's better if a doctor informs the patient, because if someone's going to get blamed for giving the person bad news, you would rather have it be the doctor than the family members. Things can be really overwhelming after that diagnosis. You sort of think, I have to deal with everything at once. No, you don't. You don't have to deal with every single thing. There are a few things that you need to deal with right away. One of them is establishing, if you haven't already, who has medical power of attorney. That really needs to be done right away. Then you have to look at the home environment. Homes are dangerous places. There are gas appliances, there are electrical outlets, there's cutlery, there might be power tools, and there might be weapons. And that's a really important question to ask, even if you think you know the answer. If it's a parent who has been diagnosed with, say, Alzheimer's, and you think they would never have a gun in their house, ask anyway, because you don't always know everything about someone, even though you think you do. Maybe there was a burglary in the neighborhood and your parents thought, I'm going to get a gun, and they didn't tell anybody. If there is a weapon, you need to get it out of there, and you also need to get the ammunition out of there. You need to look at the house and the interior locks in the house. You don't want someone locking themselves in a bedroom. You don't want someone locking themselves in a bathroom. Please don't take the lock off of the front door. You need the exterior locks, but take out the interior ones. Subjects like I said, like driving, like caregiving, I'm going to talk about separately because those are the big ones. But mainly making the house safe for them. If they're in the early stages, they might still be able to cook. They might still be able to function in the kitchen, but it's a good idea if they're not doing it by themselves. Ultimately, it's going to be sort of like child-proofing a house on steroids, because you're not dealing with a child, you're dealing with an adult. So they can get into cabinets, they can get into the garage and take the chainsaw and decide to open up a wall. I've heard of that too. So you definitely want to assess everything that can possibly be dangerous. That's the important things to do right out of the gate. You might want to talk to them about having someone come in, but like I said, I'm going to say more of that later but it's an important thing to introduce the topic early. So plant the seeds. And also, I think you have to deal with the emotions that the person who has been diagnosed is feeling. If it's your parents and both of your parents are there, usually the parent who doesn't have dementia is going to want to care for the one who does. That might work okay for a while. It's not going to work okay indefinitely, but you need to respect that. This is their relationship and they're going to have to work this out. If your parent is alone, that's a good time to introduce the subject, plant the seeds of having someone else in the house, an outdoor caregiver, outside caregiver. Here are two really big things. Driving, taking away the car keys, and bringing an outside caregiver into the house. Let's deal with the driving thing first. I mentioned earlier that the doctor, whoever diagnosed your loved one, is required to notify the DMV. The DMV then is required to bring that person back in to be tested, both the written test and the driving test. Do not assume that they won't pass that test. It's a really loaded thing, taking a car away from somebody. And the person who has been diagnosed with Alzheimer's or really any other kind of dementia is going to resist that. And I have heard of people studying and studying and studying and passing. They will, if that happens, the DMV will give them a license for a short amount of time, usually about 6 months. It's not a perfect solution. So ultimately, you are going to have to take away the car keys. It's usually not easy. I have heard of people disabling the car in the middle of the night and then saying, oh, we can't afford to get it fixed. I've heard of people stealing their parents' car in the middle of the night and saying, we can't get another one. I've heard of all sorts of things, ways to stop that person from driving. But it is really important. I mention a lot to people about the Santa Monica Farmers Market incident years ago, when the man just drove through the farmer's market and bodies were bouncing off the hood of the car. That family got sued and lost everything. So that is what happens. And if that sounds scary, it's because I'm trying to scare you. This is a big thing. Someone who has dementia really can't think expansively about everything that you need to think about when you're driving a car. Right? So the best thing to do is sort of the same tactic as with a child. If you're going to take something away, give them something to substitute. Set up a program with Uber or with Lyft. I know that Lyft, I think, has a section for elderly people. that make it easier so they don't have to always be on their cell phones and calling them. Or, and this sort of laps over into the caregiver thing, if you can find an outside caregiver who drives, but make it appealing to them. They don't have to look for a parking space anymore. They don't have to worry about putting gas in their car. They don't have to worry about anything. They have a limousine service. It probably isn't going to be a limousine, but make it palatable and make it a positive change for them, so that the fact that you're taking something away isn't the overriding reality. The other area of resistance is bringing an outside person into the house. And same as with driving, you want to couch it as not something negative, not something that you need care, you need to be watched, because that person is still emotionally aware that they don't want to feel like they're losing their minds, right? They want to feel that they can still take care of themselves. So I want to bring someone into the house so that to help me, because I can't always come over here. I'm going to be really busy now. So I want someone here to help you out. You shouldn't have to do the dishes and clean up the house and things like that. However you want to frame it, so that it's not that we have to have someone here watching you so that you don't light the house on fire. Don't say things like that. That won't go over well. Make it a positive thing. Or if you can overlap it to the driving, we're going to get someone to come in the daytimes, and she or he has a car. So wherever you want to go, they will take you. And again, you don't have to worry about parking. You don't have to worry about anything. They'll take care of all of that. Anything that you can spin to be a positive, you're probably still going to reach some resistance. There's going to be a stranger in the house. I would also recommend, in terms of caregiving, that you go to an agency, because if you go to someone independently and something happens, they get ill or they get in an accident or something and they can't come, you don't have a backup. If you have an agency, the people have been vetted. If someone doesn't work out at first, they will send you someone else. And if that person comes down with a cold or something, they will send you a substitute. So you want to be protected in that way. And it's okay if the first person who comes doesn't work out. It's okay if the second person who comes doesn't work out. Eventually you will find someone. There have been really dramatic things that I've heard of the patient locking the doors and not letting the caregiver in. Make sure you have a key to their house so that you can open the door. Ultimately, they will get used to it. People always get used to it eventually, but there might be some rough waters at the beginning. A lot of times people think that once something tragic and difficult happens in a family, like somebody being diagnosed with Alzheimer's, that a family that's maybe been fragmented or challenged in some ways is just going to band together and everybody's going to line up and be there for the person who is ill. That works in Lifetime movies. It doesn't really work in real life. The fact of the matter is, whatever your family dynamic is not only going to continue, it will probably get more entrenched. Every family has its particular homeostasis, and people cling to what's familiar. So if your brother, for example, was kind of never a participant in the family, he's not going to show up and participate now that your mother has Alzheimer's. I mean, he might come around a little bit more, but he's not really going to be a participant. Usually what happens is there is one person who takes on the burden. In the 6 years that I ran my support group, I can think of 3 families who were really cohesive and who came to the group, all of them together, and participated in the care. But that had always been their relationship. There were many, many other people who said, my sibling, my brother, my sister isn't here and it's all down to me. And I would say, well, how were they in years past? Well, they were never really around. That's how it's going to be. Things don't change dramatically. So if you are that person who has to take on that burden, it's going to be a waste of your energy if you're kind of clawing at the other family members and wanting them to be there and to participate, because if they've never participated before, they're not going to change now. And acceptance is, I think, one of the great lessons of going through losing a loved one to Alzheimer's. I've said to people often that you are not going to be the same person at the end of this experience as you were at the beginning. How you are going to be different is a matter of choice. You're either going to be harder or you're going to be softer. You're either going to be more judgmental or you're going to be more forgiving and more compassionate. And you make that choice every moment and every day. And some of that has to do with your family members. The other family members who are not there and who are not participating, they're actually missing out on something. They're missing out on the lessons that this disease can teach. And those lessons are really profound. You do end up being a different person if you're willing to go on this journey and you're willing to say, what can I learn from this? Because the lessons are very profound. And if you can just feel sorry for the people who don't show up rather than judging them and being angry and wasting your energy like that, it's a lot healthier for you. Many times I've asked someone at the beginning stages of losing their loved one to Alzheimer's, how they're doing with their grief. And most times someone looks at me like I'm crazy. Like, why would I be grieving now? They're still here. But dementia is sort of a death before dying. You're losing that person to who they once were or who you were accustomed to them being. So it's really important, I think, to acknowledge that and to know that the grieving process really needs to begin right away. We don't like to grieve. We will do anything to avoid it. And we kind of think that if we push grief out to the South 40, that it will disintegrate and we'll never have to deal with it. It doesn't work like that. Grief will come find you. And if it has to come find you, it will bring you to your knees until you acknowledge it and own it and go through it. And it isn't always pleasant. It does feel like you're, crossing a river and that you could drown there. But you won't drown there. There will be deep waters. You won't drown there. You will get to the other side. But like I said, pushing it aside is not going to work. And I think to acknowledge that you're grieving already because that person is changing, then opens you up to the awareness that, yes, they are changing and you're losing parts of them. But the truth of the matter is you're also gaining parts of them because you're going to learn things about that, say your parent or your spouse, that you never learned before. Dementia is a stripping away of all of the sort of personas and attitudes and belief systems that we develop in our life. And you get down to the core of that person. That can be a good thing or a bad thing, but you're going to get a window into that human being that you didn't have before because there are going to be no filters there. And if you're busy trying to not grieve and trying to not feel the things that you really need to feel, you're not going to be able to see that. And you're not going to be able to see those windows into that human being. People have found out things about their parents that they never knew before. Some things that they didn't want to know, like their mother had an affair, years ago and cheated on their father. They never knew that before. I mean, it's kind of interesting to actually see this person in a light that you never did before. One of the other things that comes in is anger at this fate that has befallen you. Why did my loved one get Alzheimer's? There's a guy down the block who's mean to kids and chases kids off his lawn with a hose, and he's not sick. Why isn't he sick? Right? My parent's a good person. Why isn't he sick? I don't know. And it's an unanswerable question. A better question is, what can I learn from this? How can I grow from this? And I think if you keep asking yourself that, you will keep your own vision, internal vision, open to be able to see that person and accept that person for who they are in ways that you never knew before. The thing about anger, and it is going to come up in this disease, you need to feel it. I would never say to someone, stop being angry, but I would say, is this where you want to linger? Is this where you want to live? Hopefully the answer would be no. I don't know what to say if the answer is yes. But, the thing about anger is that it always sits on top of something else, usually grief, fear. Anger is never just anger all by itself. So if you understand that about your anger, you understand that you're angry at the disease, and sometimes you might be angry at your loved one. They can be annoying. Someone with Alzheimer's can be very annoying, and sometimes you might get angry. But if you understand what it is and you understand that it's sitting on top of something else, then you're better able to move past the anger or go for a run or go put on boxing gloves and punch something, not a person. Get it out somehow. But you'll understand more the rhythm of that. And often what happens when you get angry, when you get annoyed, is guilt. And it's really common, and I've heard it a million times. Usually people are doing the best they can. You're a human being. It's a disease that will try your patience. And you do the best that you can. And here's the fact of the matter. If you get annoyed with your loved one who has Alzheimer's, they're not going to remember it. That is not an excuse to do it again, but you're the one who's going to perseverate on it. You're the one who's going to hang on to it for a week. They've forgotten it in 5 minutes. So it's important to forgive yourself. Yes, there are going to be moments of annoyance and maybe even anger. That's okay. You did that. You learned from it. Next time you'll feel it coming up and maybe say, you know what? I got to go outside for a minute and go jump rope or something to go get your blood going in another way so that you get past the anger and don't show it to your loved one. There's a saying that has evolved in the world of Alzheimer's. If you've seen one person with Alzheimer's, you've seen one person with Alzheimer's. It is true that people manifest the disease differently. However, there are some really consistent things. One of them is that people get stuck in a loop. They just keep repeating the same thing or keep perseverating on the same thing. There are techniques to get them out of that, and usually it has to do with changing the environment. If someone, I don't know, thinks that someone is going to be coming to visit them, and they can't get that out of their head, and that's not really the case, that person is not coming to visit them. If you change the location, if you walk them outside, if you tell them, let's take a walk around the neighborhood. What you don't want to do is make them wrong. What you don't want to do is say, no, you're wrong. That person is not coming. This is particularly true if someone has Lewy body dementia, by the way, because Lewy body dementia is vastly different than Alzheimer's and involves hallucinations. I have a friend whose friend has Lewy body dementia. He called me and he said, she thinks there are people on the roof, and there are men on the roof, and I keep telling her that there aren't people on the roof. And I said to him, well, stop doing that. Go outside, look up there, come back in and say, you're absolutely right, there were people on the roof, but I chased them away. And if they come back, you let me know. You don't want to make the person wrong. So, like I said, something like Lewy body dementia where there are hallucinations, that's going to come up more dramatically. But even someone with Alzheimer's, they're going to get stuck in the idea of something and aren't going to be able to get out of it. So you need to change the subject, change the environment. And, usually that works. It might take a little bit more creativity than just walking outside, but you will be able to get them out of it. The other thing that is really a good tactic to develop is lying. I know we've all been raised to not tell lies and to always tell the truth, but in the world of dementia, lying is your friend. Again, you don't want to make someone wrong. And as the disease progresses, people quite often think that relatives who have been dead for many years, friends who have been dead for many years are around and are going to come visit them. And why haven't they called? And why aren't they here? You don't want to tell them that they died 10 years earlier. If they grasp that, then they're going to have to grieve all over again. And then they'll probably forget again, and it'll be like Groundhog Day for grieving, and you don't want to do that. I've heard of people getting very creative, that those relatives are on a round-the-globe cruise, and there's no cell service, and they're in Iceland now, and they'll be back. It doesn't matter what you say, just something that is not a negative, right? They can't come right now. I don't know, they're getting married in the Caribbean or something like that. They're renewing their vows in the Caribbean, even though they've been dead for 15 years. It doesn't matter. Just make stuff up, right? So you have to get past that thing of, I should never tell a lie. In this context, you need to tell lies, and you need to get good at it too. It's helping the situation, and it's helping that person. And that even gets down to little things. It's August and they think that it's December. Okay, go get some Christmas lights and put them up. I mean, what does it matter? It doesn't matter what month they think it is or what month it really is. Just go with it, which means you have to get creative. So for the very serious topic of when things are getting worse, we have a second emotional support animal here. Things will get worse, and decisions are going to have to be made that are really serious. Even if your loved one is in their home with a caregiver, things can still happen. They can wander off. They can get hurt. It might be too much for one caregiver. Also, people with dementia in the latter stages really respond to structure. And that's when the question of a facility really needs to be asked and dealt with, because there is structure. There is a particular schedule in facilities. And a lot of times, I've heard people say, well, I feel like if I put them in a facility, I feel like I'm abandoning them. To which I always say, abandoning someone is driving them out to the Mojave Desert, throwing them out of the car and leaving them there. Abandoning someone is not putting them in a facility where they're going to have round-the-clock care, where they're not going to be able to wander off, where they're going to have structures to their days and their evenings that will be dependable and that they will get used to. and learn to rely on. So, it is an important decision to make. And if you do decide to look at facilities, the other thing that you have to know is you're not going to be the one in there. I've heard people say, well, I didn't like the color of the walls, or, I didn't like the carpet. And by the way, people with Alzheimer's don't do well on hard floors, so carpeting is a good thing. You're not going to be there, and they're not going to really be dwelling on the color of the walls. The other thing that you need to know is any reputable facility is going to advise the family members to not visit for at least 2 weeks, because that person needs to acclimate themselves. They need to understand that this is their home now. And if you're constantly coming in those first 2 weeks in that transitional period, they're going to be confused. They're going to want you to take them home with you. They're not going to settle into the idea that this is now my home. The other thing that is really important is to bring things that are familiar to them. Pictures. If they have a favorite chair, bring that favorite armchair there. Their bedding, although that's not as important, because some of that has to do with some of the reasoning of bringing the bedding is that it has their familiar scent on it. But most of the time, someone with Alzheimer's has lost their sense of smell. So that's not that important. But if they have a particular pillow that they like or something like that, you want to recreate enough of their home environment that they will feel at home. And then stay away for a couple of weeks. It's really important that they melt into this new reality, this new environment, and they will develop relationships there. Sometimes they will develop romantic relationships there. That happens a lot. So you have to be willing to, again, just accept whatever is about to happen. It's very difficult having someone with any kind of dementia in your home. I know a lot of families bring a parent into their home with them. That's not always fair if there are kids there, even if there are older kids there. The focus is going to be more and more on that one individual, and you're going to see sort of negative ramifications in your own family, because no one else is going to be being paid attention to, just the person with dementia. So if it is possible and if it can be afforded, and I know that facilities are not cheap, but if it can be afforded, I think that there are definite benefits to it. There's also the fact that medical care is, or you need to ask about this, is readily accessible. There are people there always monitoring them, monitoring their health, monitoring their welfare. A lot of times it will seem like it's the end. And I've heard this many, many times, that someone has said, oh, you know what? I don't think they're going to live. My parent, my mother, my father is going to live another week. And they end up living 6 more months or a year or something like that. So you don't know. You don't know what is, there can be an up and down journey on that one. But there are oftentimes moments of lucidity where the person who is ill does know that their life is ending and wants to talk about it. And if they do, let them talk about it, and let you yourself talk about it, because it's really important. It's, the relationship that we have with our own mortality is a pretty intimate one and a pretty important one. So if someone says, I'm dying, don't say, oh, no, you're not. You'll be around for a long time. They're trying to have a conversation about something that's really difficult and that they're aware of. And even someone with dementia does know if they are reaching the end or if they're close to the end. They feel that. They haven't gone numb to their own emotions. So it's something that you need to participate in, even if it's uncomfortable for you, and maybe it will be, but it's uncomfortable for them too, and they're trying to reach out and talk about it. And when the end does come, or even when it's close to the end, relief is part of the experience, and it's nothing to feel guilty about. By that time, you've gone through a really long journey, and not always an easy one, and sometimes a torturous one. So grief is a lot of things. You've missed this person for a long time. Hopefully you have been going through the grieving process for a long time. And there's going to be another stage of grief. And one of the things I think to be aware of is the tendency to say, oh, I know how I'm going to feel. I mean, I've been missing them all this time. I've been grieving all this time. So I know how I'm going to feel when the end comes. No, you don't. You don't. It's the same important thing to say, I don't really know what's going to happen, but I'm willing to learn. I'm willing to grow into this experience, because there might be a whole other, and probably will be a whole other stage of grief. And part of that is relief that it's finally over. And that's okay. That doesn't mean that you didn't care about them. It doesn't mean you didn't love them. It means that you've been going through a hard experience, and now it's over, and you can breathe a little bit more easily. Caregiver stress is a very real thing. It's really why I wanted to start a support group, because I saw what it was doing to people, and I felt it in my own experience losing my father, even though my parents had plenty of help, just the emotional impact of losing someone to Alzheimer's. But for people who are hands-on caregivers, and I know that financially sometimes that is necessary, that they aren't able to hire outside help, at least not for a lot of the time. So you really have to understand that you're in this picture too, and you have to take care of yourself. I've likened it a lot of times to being on an airplane, and they tell you about when the oxygen mask drops, and they tell you if you're with a child or with someone who can't take care of themselves to put your own mask on first and then take care of them. So you need to take care of yourself as a caregiver. You need to be your own caregiver in order to be a good caregiver to someone else. And if there are financial constraints in terms of getting someone in to help, I think there are ways around that, or ways at least to give yourself some breathing room. A lot of times, if you look at an insurance policy for your loved one, if you really read the small print, there are allowances for a certain number of hours of outside care. Sometimes if there are a couple of different policies and you add those up, you get some relief. You get some hours of relief. A lot of times also, if you know someone else who has caregivers, maybe you can, get them on recruit them on their off hours, just for an hour or two, just maybe for bathing time or something like that, to give yourself some respite. And then what's important is when you do have that time, to really take that time for yourself. Don't leave the house and leave your loved one with someone and then go away and call them every 5 minutes to see how things are going. That's not giving yourself a break. You really need to give yourself a break. I think the tendency is a lot of times to think, well, I'm not important here. They're the person who is ill. Well, you didn't make them ill. Why, who said that you sacrificing yourself and your life is going to benefit the situation? It's not. It's actually going to hurt it. So you need to carve out that time for yourself. And if you are someone who, as I said, who financially has to be a hands-on caregiver, try to carve out a little bit of time each day for yourself, even if it's getting a friend or another family member to come in for an hour a day, 2 hours a day, so that you can go off by yourself and have your own time to go have lunch with someone. And that's the other thing. I think people sometimes feel guilty about going to a movie or going out to lunch with someone or having a nice time, because my loved one can't have a nice time, so why should I? Again, your sacrifice is not going to help anything. Understanding that you're worth taking care of too is going to be beneficial to everybody. One of the things that comes up toward the end of your loved one's life is a question about hospice. Hospice is really a gift for someone at the end of their life. First of all, they have counselors, so you benefit from it too, because they can talk to you. It is a recognition that life is ending. And a lot of times people think, well, what if I sign up for hospice and then you sign up for 6 months? And what if they haven't passed away in 6 months? Then what? Then you sign up for another 6 months. It's okay. You can just keep signing up. You don't know when someone's going to die. You know that the end is near, but you don't know. The other advantage to hospice is that they have morphine with them all the time. They have it readily accessible. A doctor has to go somewhere, get it. It's not that easy to get, right? And toward the end of someone's life, a lot of times they do need to be eased out of this life with morphine because you don't want them to suffer. So if organs are shutting down and they're in discomfort, you want to give them some kind of medication to ease them across, right? And hospice is prepared for all of that. So it's to your own advantage because you get the benefit of their counseling, and they know what they're doing. Their end of life is what they do, and they do it really well. So I think it's a very important thing to consider and to avail yourself of.